Welcome. I'm Chesapeake Mayor Rick West, and I want to make sure that you all feel very welcome to our very first edition of the Mayor's Emergency our Mayor's Emergency Response Roundtable. We had to do a lot of work to come up with that name, so again, we would just welcome you here. This is going to be a rather informal presentation or talk with you, and for a lot of different reasons, so just bear with us. I got thinking about this past weekend. My wife and I were doing something that we don't normally do during the middle of the day on a weekend, and that was we were in front of a TV watching a presentation or a press conference from the President of the United States, and we have spent so much time just listening to our state and federal officials telling us the things that are happening and things that are changing so rapidly with this coronavirus. And so we got thinking about what would be our role as a local government and how are we to respond to this. And it occurred to us all, and as we talked about this Monday morning, it occurred to us all that I think the best thing to do is to provide a method so that you can be heard, so that we can listen to what your concerns are. You know, it's the local government's responsibility to implement all these changes that are coming down. And I don't think anybody could have ever imagined, even 2 weeks ago, that we would be here doing something like this. But here we are, and we're going to find ways to address these issues. We're going to find ways to hear from you. And I just want to thank everybody for being here, and I'll be introducing in just a few minutes those that are here to talk about different questions that we've gotten since we sent the word out. As I said, our three main purposes is one, to hear your questions, to hear your suggestions, and to provide you with accurate, factual information regarding those suggestions or those questions or your opinions. What this is not a press conference. This is not your latest thing that you're going to be told what to do. It's just the opposite of that. And we are not going to be talking about political agendas or people's policy issues. This is not the City Council. We're not here to make policy. I am the only elected official here, and so it would be inappropriate for me to talk about policy without our City Council. Our council makes policy, and so we're not going to be discussing what kinds of policies that are going to change. Our city did form a united command team, bringing together the city's health department, the schools, Chesapeake Regional Health Care, and many others. They meet regularly, both face-to-face with social distancing and through technology, as they shape our strategy to meet the ever-changing challenges of COVID-19. We know that there are a lot of information about this virus out there. Some of it's really good, and quite frankly, some of it is totally wrong. The city is doing all we can to push out the most accurate, timely, and science-based information that we can. So I want to encourage you to look at our website and our social media sites, as well as the Chesapeake and Virginia Health Department and the U.S. Census for Disease Control for information that you can actually trust. We know that you have questions, and that's what this is, and the future roundtables are going to be all about. I think you're going to see these roundtables sort of change as to who the participants are based on the questions that you send in to us. So I'm going to ask each of my colleagues to first of all make a brief opening statement, and then we'll address as many of the questions that you've already submitted as we can. So let's start with the leader of our Unified Command Team, Chesapeake Health Director, Dr. Nancy Welch. Dr. Welch.
Good afternoon. As we all know, we're in the midst of a pandemic now. We have no vaccine, we have no treatment, and no one is immune. What we do have is a city that cares, and we have sound epidemiological practices that we are using. Our goal in all of this is to move us to herd immunity. That's when so many people have been exposed, they have an antibody, and they basically kill the virus so it can no longer cause harm. Fortunately, with this disease, 90% or so have mild or very, very simple, easy symptoms. They may think it's allergy. But the point here is that in moving to this stage of herd immunity, that we don't do it so rapidly that we jeopardize those who are at risk of more severe illness, those who are older, those who are immunocompromised, who are hypertensive or diabetic. We do not want to overtax our healthcare system, which I fear has occurred in some of the other countries. The way that we avoid that is by practicing physical distancing, and I prefer the term physical distancing. I know that a lot of what's been implemented is inconvenient. It's scary. It may be having some economic impact as well. But the bottom line of what this whole process does, it does not change the number of cases, but it changes dramatically the number of deaths. And that's what we are trying to do so that we can gradually move to herd immunity with as many people alive and healthy as possible. Thank you.
Thank you, Dr. Welch. I'm going to be coming back to you with some questions to talk a little bit more about your opening statement. So next, I'd like to call a gentleman whose team has been at the epicenter of many of these questions and concerns since the response started. My friend and our superintendent of schools, Dr. Jared Cotton. Dr. Cotton.
Thank you, Mayor West. I appreciate the opportunity to speak with you here this afternoon. As you all know, our governor ordered our schools to be closed for the remainder of the school year. While we weren't anticipating schools being closed for this length of time, we certainly understand the rationale behind this. But at any rate, it was a shock to many of us when we heard the news yesterday. And we're deeply saddened for our students, for our staff, and for our families. Our students love coming to school. They've built great relationships with our staff. And of course, as I've been watching social media over the last evening, we've seen a lot of feedback from our communities, knowing that we're going to get through this together, but also feeling frustrated that our teachers and students will not be together again for the remainder of this school year. We have lots of questions, as you might imagine, and we are going to provide answers. We do have on our website, cpschools.com, we have a COVID-19 tab, and we've been monitoring that regularly to answer questions. As a matter of fact, we get several questions all day long and throughout the evening, so please use that resource, and we're turning those into frequently asked questions that we're posting on our website as well. Constant communication is coming to us from the Virginia Department of Education as well as other state leaders providing us with guidance. I know that you want answers immediately. Please be patient with us. As you know, this is an unprecedented situation that will require flexible and innovative solutions, and we are going to get you the answers as quickly as we can. I know we'll talk about some of those answers today. To all of our employees, I'd like to thank all of them. It's been all hands on deck as we work to refine how we deliver our instruction and how we move forward. We're telecommuting, working from home and working from various places to follow the guidance of our health department, of course. We're proud of our employees for quickly responding and collaborating through this new way of teaching and learning. And we have some hiccups in the road, which we'll talk about as we go through today, and we'll keep working toward that. We'd like to thank our families, especially our students, for their patience, and our parents for patience and flexibility and understanding. Please know that answers are coming as soon as we can get those to you. We're all in this together, and as we've been telling our community, stay safe, stay home, and stay connected. So thank you. Look forward to answering questions this evening.
Thank you, Dr. Cotton. You all are doing a great job. You and your team, you're really out there doing your best to keep students and parents and teachers all informed. And as you said, it is a quickly changing set of rules that which you're having to deal with. So we certainly appreciate all you're doing. Next, I'd like to ask Dr. Amber Edged from the, did I say that correctly?
Yes, you did.
Good. I had a little secretive way of saying it correct, right? So I'd like to ask her to speak to from Chesapeake Regional Health Care with a few opening comments, and again, we'll be going back to her with some more specific questions.
Good afternoon. As a healthcare organization, we are on the front lines of this rapidly evolving pandemic. As a result, Chesapeake Regional opened its command center on March 9th and immediately began implementation of a robust emergency response plan. This plan allows us to safely care for our patients, employees, and community. We rely daily on information from the CDC, the Department of Health, other local and regional resources to help us to continue to monitor this pandemic, respond with the best care that we can, and put in the safest practices to keep our organization and those we serve safe. Some of the things that we began to immediately implement are segregated spaces within the ER that separate respiratory patients from other patients to stop the spread of potentially infected COVID patients. We opened a medical tent outside of the hospital, and we began restricting visitors to our organization, and we have screening at all entry points of the hospital. We also have curtailed non-urgent procedures, testing, and surgeries, again, as a way to prevent infection and to keep people safe and to utilize our PPE, which is our protective equipment for our healthcare workers, in the most conservative fashion. We also have a dedicated respiratory unit that allows us to provide care in one cohorted area of the hospital for our patients that we suspect COVID-19. We began implementation of policies that help our staff respond in a manner that will allow for the best care that they can deliver using the most up-to-date equipment that we have available and protective devices such as eye masks, face shields, eye goggles, face shields, other respirators, gowns, and other things that you may have heard on the news that are of shortage. Right now, we have a good plan to keep our employees safe, and we look and monitor our equipment list daily. We also have plans for telehealth visits to, again, limit that traffic. And as Dr. Welch and others have said, it's really about staying home, staying safe, and preventing the spread of the disease. Our organization and all of our healthcare providers have responded courageously to this call to provide care during a pandemic, and we are so proud and thankful for the employees of Chesapeake Regional and the care that they have been delivering and are set to deliver should we see the spread of the virus continue.
Dr. Edged, this is not a question, I guess just a comment. One of the signs we keep seeing on Facebook that has such a powerful impact on us is that we're here risking our lives. And what's the rest of that? And you could, the least you could do is stay home.
Yes,
Yeah,
yes,
protect
I saw
ours.
that before.
Yeah, it's a very powerful
Yes,
message.
stay home.
Yeah. And so I think I appreciate you saying that. I'll tell you, ever since you've been at Chesapeake Regional, everybody knows how much Chesapeake people love Chesapeake Regional Hospital. You are our hospital since its inception. But I hear so many wonderful things about what you're doing and appreciate what you're doing. Again, we're going to get back to you to more specific questions as well.
Thank you.
So last but not least, of course, is our city manager, Chris Price. I would like to ask him to do his opening remarks at this time.
Thank you, Mayor West. I appreciate this opportunity. I think it's a great way to get information out to the community that's fact-based and science-based. And I'd like to briefly talk about two elements of what we're doing. One, you've all mentioned unified command structure. I want to talk a little bit to the community about what that means. And then two, talk a little bit about what we've done here in the city to make sure that we're still able to provide services to the community. The unified command structure it's a very valuable tool in a variety of emergency response situations. And Chesapeake has a long history of working together in a unified command to tackle a variety of issues. And what that structure allows for is all of our partner agencies, all of the folks that you see here, city, schools, hospitals, health department, other community partners, get together and put together a formal structure with information and logistics and policy, and it serves a variety of purposes. Number one, perhaps most importantly, it provides all of the decision makers a chance to get together in a forum where you can quickly receive information in real time and make decisions and execute on those decisions. So it really reduces the delay in trying to go through a chain of command to get to the right decision maker to be able to make something happen. Really streamlines that process. Another thing it does is make sure that we're putting out information where we're all on the same page. There's so much information out there. Much of it, actually, it's bad information, misinformation. And it's a good way to make sure that the information that's provided to the community is fact-based and science-based, real-time, based on best available data, and that everyone has access to that same information. So I'd encourage you to continue to take a look at the city's COVID website. We put information there as soon as we have it that comes through the Unified Command, and that, along with the Chesapeake Health Department, Virginia Department of Health, and the U.S. Centers for Disease Control remain the best sources of information that you should use to make decisions during this crisis. Turning now towards city operations, using the data that came through the Unified Command structure, one of the first decisions that I made was to close facilities to the public. So I closed the city facilities to the public, but that doesn't mean that we're closed for business. Our services remain available to the community. Essential services remain unchanged. You wouldn't notice any difference in trash collection and police and fire, building code inspection, a lot of the different services, water service delivery, a lot of the services that we provide remain unchanged. All of our other services remain available, but in a modified manner. We've asked the agencies to be very creative in the way they do business. Much of the business that we do can be done from remote locations, and here in a hurricane-prone area, we have a lot of experience in being able to deliver services from remote locations. So we are well positioned to do a lot of our business from places outside of City Hall, and we're executing those plans that we've had in place for a long time and adapting and doing them for a different reason. So that's the first message I really want to deliver on city services, is that all services remain available even though the facilities are closed to the public. And I encourage you to call us or check out our website if you want to access a particular service. We will get you connected with the people you need to provide that service. The second thing I want to say is, as an employer, as a very large employer in the city, it's my responsibility for the safety and security of our team members here that are doing an outstanding job providing services to the community, to make sure they and the community are conducting that business in the safest way possible. So for those services that can be provided remotely, I've ordered that people provide those remotely where possible. And for those that can't be provided remotely, I've ordered that we take the maximum steps that we can to ensure physical distancing. So making sure there aren't lots of people together in a room, there's appropriate space between people when they're conducting business. We've had a lot of really innovative ideas like the library curbside pickup service, things that we might continue even post the COVID-19 situation, because they're great ways to provide services to the community. So we're learning a lot about ourselves in the community, and the lessons we're learning, I think, will pay dividends in the future. I think we're learning the benefits of being well prepared and having had a long history with our Unified Command structure, learning a lot of ways we can do business differently, the outstanding talents that we have with our employees in the city of Chesapeake, and the outstanding understanding, patience, and resilience of the community. We appreciate it greatly, and we look forward to finding ways to continue to serve the community. Thank you.
Thank you, Mr. Price. And that's a delicate balancing act that you're just talking about, providing services and providing safety. And I think sometimes we as citizens don't realize just how important those services are, not just for our convenience, but to keep the economy going, to keep people working so they can provide for their family. So it is a delicate act, and I certainly appreciate all that you're doing and the staff is doing to make all that happen. So now let's begin with our questions. First to Dr. Welch. Dr. Welch, we are telling folks to avoid restaurants as far as sitting down to eat, but there are questions about the safety of both delivered and takeaway foods. Can you address that?
Glad to, and I'm glad you asked. And we want people to do that takeout and carry out. A strong business is a strong economy, and that leads to a healthier community. And we are still inspecting restaurants. Just because they're not having sit-down doesn't mean they're not inspected. What we inspect relates to the fact of how they're preparing the food, being sure they're using good food hygiene. We still want the food that goes out that is safe, and we want the employees to be preparing it in a manner that reduces any possibility of transmission of any kind of illness. So we still check temperatures. We still do all the same kinds of checks that we do even when there is dine-in service.
Thank you very much. Appreciate that. Next, to the hospital. Amber, the citizens ask, what is the current occupant number in the hospital versus capacity? So basically, I guess, how much impact is COVID-19 having right now on the hospital's operations?
At this time, our current capacity is 310 beds. We have 199 patients as of 3 o'clock this afternoon. And although we're seeing an increase in respiratory patients, we're not necessarily seeing a large volume surge, and I'd like to believe that's because people are taking advice and staying home, when, if not needed to have that additional foot traffic out in the public. So we continue to develop and monitor our surge and our ability to flex treatment spaces as we need to.
Great. Thank you. Dr. Cotton, you are clearly getting a huge number of questions directly since the governor's announcement that school's closing for the rest of the year. Many are asking about things like grade level requirements, credits, and even if students will have to repeat the year. Can you address those areas in a summary?
Sure, good question. When this first happened with the initial closure, we were given guidance just to keep our students engaged in learning for the first 2 weeks. And fortunately, my teaching and learning team had already started to prepare for the possibility. And lots of parents have asked the question, why are you not teaching new content? Why are we just reviewing old content? And that was because of the guidance that was provided, because first of all, not all students have access to internet or devices at home, not to mention the fact that there are other challenges that we face. So we did do some learning packets initially, but moving forward, we just received some guidance today that we really have to look at lots of different options to provide ongoing instruction for our students. The most important thing I want to say to our parents and our students, seniors who are already on track to graduate and are in good standing, they do not have to be concerned about graduating. They will graduate. I've received several questions from parents who have asked if their child's going to graduate. There are certain things that we're going to have to do as a school district to support that, and there are certain things that our students are going to have to do throughout the rest of the year, and we understand that some of that will be delivered through online, some of that will have to be delivered through learning packets, and some of it will be posted on our website, which we've already been doing throughout this process. Also, other students who are on grade level, working, keep in mind our students have been in school for several months before this happened. They will continue to progress and move to the next grade level. We're not going to have a bunch of students retained in the current grade level. With our flexibility, we're going to provide instruction for our students on content areas that would have been missed as we would have gone through the rest of the year. So I want to ease our parents' concerns. We just discovered this yesterday that we're closed the rest of the year, and literally just got guidance today that we're working through. So we will provide additional information as we move forward. but I just wanted to relieve some stress in some of our families and our parents who are concerned that their children may not graduate or may not move to the next grade level, and that is not going to be the case. The only exception would be students who are already not meeting standards, but again, that's a case-by-case basis, but the majority of all of our students will continue to move forward.
I think that's exciting news and a relief for a lot of people. Dr. Cotton, I know my daughter teaches, and she was worried about not in this city, but she was wondering about her students, and I don't think she's gotten that direction yet, but I know she would love to hear that sort of thing in her city as well. Dr. Welch, we know that COVID-19 can be spread through contacts, but does that include things like, say, gas pumps, ATM machines, and so forth? And what should people do to protect themselves? Does everyone need to wear gloves?
Good question. Of course, that's the question of the day and will continue to be a question. I'd like to sort of think that all germs, bacteria or viruses, sort of have their entryway or their door to people's system. And they're different. They vary. Just like us as people, these germs are different too. And so with the COVID or the coronavirus, their entry point or their door is the face. If I may do a comparison, if you're going to get into a car, you can touch the door, you can touch the roof, you can do all of that, but unless you open that door and go in, you're not going to be in the car. And that's the way these viruses are. Their door is our face. It's the respiratory system. They do not get in through the skin, so you can touch all you want. We could put germs right on your hand, but they do not get in through your skin. They have to go to the door. So what do? You wash your hands a lot. You use hand sanitizer. And some people say, some of the studies have shown that we touch our face 23 times an hour. Who knew? Certainly wasn't something that was analyzed before the situation came up. But when you think about it, I know myself, I find myself, my hands up here, and I didn't even think about it. So what we're doing then is if we have not washed our hands, we are taking that virus to the door and saying, come on in. So we want to wash our hands. We want to pay special attention to not putting our hands on our face and touching our face. If they don't get to the door, they can't cause disease.
Thank you for that. You know, and as you're making that comment, I'm sitting here, and my hands are on the desk that I don't know has been sanitized, and I'm coming up here doing one of these, trying to look intelligent. And if 23 is the average, I probably do 36. And when you tell me not to, then the first thing I want to do is just almost put my hands in my mouth. So, yeah. My wife has been telling me this ever since we got married, and she's a nurse, of course, and so she says, don't watch. And, you know, I've kind of taken it as, who do you think you are, my mother? But as it turns out, she was right. And I should have been listening all the time, so I do publicly apologize to her. And thank you for that. And let's just remind each other to do that, because it is basic. And it's really difficult to not do, right? So be rude and say, put your hands down. Thank you. So the next question is a little bit sensitive. We've been asked, several people asked about the extensions of things like personal property taxes, business taxes, and so forth. And I'm going to try to answer that. But again, as I said earlier, I tried to say in the introduction, is that I have to be very careful to not talk about and really take a position on policy without our council here. As I said, I'm only one member, and what my feelings about a particular issue may or may not be what the council agrees with. So I will just tell you that, you know, the council has been asked to look at these issues. We will be relying heavily on the Commissioner of Revenue and the city treasurer. I have talked to other cities to find out kind of how they're doing that. So I don't have an answer for you at this particular time, but we are going to be taking a look at those kinds of things. And as you know, we all do have to provide services. That's what taxes provide services, and we don't want to be in a financial position to not be able to do that at the same time. We want to be sensitive, and we will be sensitive. Everyone should know that city will work with anyone who has a legitimate COVID-related concern when it comes to making any types of payments. I'm talked to our treasurer a couple of days ago, and she reassured me that that's been her job for the 30-some plus years that she's been our treasurer. And I know Barbara Caraway, I know that she will continue to consider exceptions and issues such as those. So we have a lot of confidence in her and in Mr. King for those types of things. So let me, one other thing, Mr. Manager, I think you've made the comment that we will not be turning water services off during this emergency situation as well. So I want to make sure I was kind of reinforce that, correct? Anything else that you want to add to that?
Yeah, if there are folks worried about essential services, you will not see a change. Your police, your fire, emergency services, trash services, and water services, we will do everything to maintain those services.
Okay, next I want to turn back to you, Dr. Welch. This seems to be a question on everyone's mind. If there were just one or two things that you could, that you would want the average person to do over the next week, what would those things be?
Good question. First, I think it's probably obvious because I've mentioned it. I would like people to really understand the value of physical distancing. And I say physical distancing, and I'll reference why I call it that rather than social distancing. This is about our community coming together and saving lives. So I want people to really understand how what we do individually is extremely valuable and comes together as the community, and to hand wash and do the hygiene things as well. The second part, in terms of the second thing I would say, is to understand that we are social beings. I'm not about, by any means, to think that we can survive psychologically by just physically distancing ourselves. So the second part of my wish is that they are able to combine physical distancing with social connectivity. I want us to come out of this again together and whole. And in today's technology, fortunately, that's possible. You can do physical distancing and still do social connectivity, Skype, messaging, whatever. And I can promise you that this virus, coronavirus, will not penetrate those tech lines and ruin your system. But instead, by doing this, I think that you'll have a great deal of comfort that will come through those lines.
Thank you. And Dr. Welch, before we came on the air here, I had you off the air, and I thought, well, okay, I'm going to throw this question to you because I will get the straight scoop from the health director. No one's listening. She's going to tell me the absolute truth, and I'll know something that no one else does. So I asked you, I said, what do you believe, what do you really think our chances of containing this? And I loved your answer. It was perfect. And your answer was, that is up to us. And when I say us, we're not talking about experts. We're not talking about political leaders. We're talking about each and every one of you, the 240-some thousand members of this city, citizens in this city that are being asked to do some extraordinary things. So I really thought that was a very important answer, and one that we all need to hear and practice. So thank you for that, and I appreciate your leadership. Okay, Amber. We hope and pray that the COVID that everybody does what they're supposed to do, as we just said, they practice the social distancing and keeping those teenagers from socializing and coming home and bringing that back. But what if? What if the hospital, we do get inundated with COVID cases? What are the plans at the hospital?
Our emergency management team has spent many hours planning for surge capacity should it reach Chesapeake. We are well positioned and have thoughtfully planned where we would add additional treatment space to care for patients, utilizing every area of our organization. Once we reach that space, and I hope that we do not get to that point, we would then work with the city and consider utilization of creating a hospital space in school district, in empty schools, and utilizing resources from both local and regional and even national and state support to help provide equipment should we need those alternative care areas, such as one of the schools in the city of Chesapeake, to create mini hospitals.
Thank you. And you know, one of the things we keep hearing from everyone or on the news are the ventilators and the mask. How are we set for that?
So from a ventilator perspective, we would pull all of our resources and equipment from all areas of the organization, which would allow us the capacity of 85 ventilators should we need them. If we were to be hit like other areas of the country, we would need additional ventilators to be allocated to this area.
Thank you again. Next, Dr. Cotton, about the school buildings. Now that they are closed for the year, where will will there be extra cleaning taking place, and will teachers be able to access their buildings if they need additional things from their classrooms?
Yeah, I'm pleased to report that our custodians were very diligent in cleaning on a daily basis. We talked about all of those protocols and how they need to be reinforced each and every day. And of course, the day after the initial, the Monday after the initial closure was announced, we brought all of our custodians together, and I'm very pleased with the work that they've been doing. Of course, our buildings have been closed since March 17th, so we have not had anyone in those buildings. Of course, if we bring people back, then cleaning will have to resume. Currently, we have not allowed building access, but we do understand that with this new announcement, we have parents, we have students. I keep hearing about students who left their instruments in the school and they'd like to practice. I'm sure the parents would appreciate that if they brought their tuba home to work on practicing throughout the closure. And of course, we have teachers who need materials and supplies, students who need supplies. So we are working on a plan to open our buildings during a set period of time. Of course, we need to follow guidelines provided through physical distancing and also less than 10. So we'll have to work through that. A plan is coming. So I just want the community to know that we understand that you have a need to get into the buildings to get certain things, and we will have a plan for that announced shortly.
Thank you, Dr. Cotton. So another question that we heard repeatedly was a question about the May elections. Should we move the date? I just want to tell you at this time, the voter registrar's office with Chesapeake is talking to the State Board of Elections about what our options are regarding this important event. And evaluating what is a fair and safe way to conduct this next election. In the meantime, I think everyone is being encouraged to vote absentee ballots or to vote online. Those options are being easier and easier to implement. I did it, and if I can do it online, I think anyone can. So go do that regardless of when the election is going to be. I know that many people have already voted. Mr. Price, we've been getting a lot of questions regarding cities, operations, building closures, essential services, and so forth. Can you give us something of a survey of where the city organization is right now? And I think you've addressed some of this, and how you're working to minimize the impact of both citizens and employees at this challenging time.
Thank you. As I mentioned earlier, our initial response in coordination with the other Hampton Roads localities, we closed our facilities to the public for 2 weeks and spent those 2 weeks really figuring out how we could effectively deliver services remotely to the greatest extent possible. Again, in coordination with the other Hampton Roads localities, we have now expanded or extended that closure to the public until further notice. So instead of pushing that date out further and further, we're trying to minimize disruptions to the community. And so when we know when it's safe to reopen those buildings, we'll schedule sort of a soft opening for some services and then a hard launch of reopening the entire city facilities to the public. And we'll make sure that we push that information out through all available channels so people will know when we're reactivating it in a normal schedule. In addition to the physical distancing measures that I talked about earlier, Dr. Cotton brought up a good point that I'd want to highlight a little bit on the city side as well. We have significantly expanded the housekeeping protocols that we have here in our facilities. So we're doing housekeeping multiple times per day and very rigorous housekeeping during the overnight hours. So the enhanced housekeeping coupled with the physical distancing and the less people here in the facility should hopefully do as much as we can to combat the spread. One thing I want to stress is that in addition to the short-term issues that we're facing, making sure that we're able to maintain services, not just the essential services which we will certainly provide in any event, but all of the services that we want to continue to provide. We're not just focused on the short term, we need to keep our eye on the long term. So to make sure that the short-term crisis doesn't turn into a long-term issue for the community. So pushing out services like eBuild, which is our online development portal. We want to continue to encourage businesses and developers that have projects in the pipeline to continue to advance those projects so that we don't have major interruptions to the economy that will last long beyond the duration of the event. So to the extent that we can here in the city of Chesapeake, we want to continue to do business, push those services online, and shorten the recovery period once we get through this.
Thank you very much. So we've covered a lot of grounds, and we know we have a lot more questions to come. I want to thank each of you for being here and answering candidly, and hopefully we've provided responses that will be helpful. I will tell you that we are committed to this format as long as it is useful to our citizens. If we find that it is not something you want, then we will stop. But if our plan is to continue doing it. And as I said earlier, the participants will sort of be determined by the types of questions that we get. Our next edition of the Roundtable is Thursday evening, March 26th. All of the roundtables will be available on the city's social media platforms and on the website at the cityofchesapeake.net/COVID-19. And I want to make it clear that we're simply not able to answer every single question, not right here, but we've tried to cover as many common topics as we could. And if you have questions that are related to very specific situations, either in your personal or business life, I would suggest you contact either the city, the schools, the health department directly, as we don't want to violate any sort of privacy regulations in this particular venue. So likewise, we're only going to be addressing questions of a COVID-19 specific nature here. I want to thank you all for joining us at our first Mayor's Emergency Response Roundtable. I want to ask you all to be safe, to stay well, and to keep washing those hands. Thank you.